Morning. This is the last topic we have for Clinical Chemistry 2, and for today we will talk about toxicology and tumor markers. Let us start off with the basic elements of toxicology. First, the definition. Toxicology is the study of poisonous substances. How do we get exposed to these poisonous substances? Poisonous substances can also be called toxins or poisons. It may be because of suicide intentionally, and it can also be accidental or because of exposure, occupational exposure. For example, as medical technologists, we are exposed to some chemicals that can be harmful to our health. Number three, routes of exposure. How do we get these toxic substances? It can be ingested, inhaled, or absorbed through our skin. The toxic response, this is the amount of damage that is done to the organism when the substance is administered at less than the lethal dose. Number five, acute toxicity. This is a one-time exposure of short duration to an agent that immediately causes a toxic response. And chronic toxicity, that is when the individual is exposed numerous times or for an extended period of time to an agent at a dosage that will not cause an acute response. Right, so how do we analyze these toxic agents? There are screening tests and there are confirmatory tests. So the screening tests are the first that we have to perform, and usually this is qualitative in nature and may not be specific. However, it may be sensitive. Number two, confirmatory tests. This is quantitative tests, usually with good specificity or sensitivity. Examples of these are chromatographies, assays, and immunoassays. Let us talk about specific poisonous substances. The first one on the list is alcohols. They are organic volatile substances with a general formula ROH. Though there are many types of alcohols, the first one is the ethanol, and this is the most commonly abused substance. This is found in alcoholic beverages like beer and wine, and chronic exposure to the substance can lead to toxic hepatitis and cirrhosis. Number two, methanol. Ingestion is related to severe acidosis, blindness, and even death. So that means it is a lethal substance, very poisonous. That is because methanol is converted later on to formaldehyde and then metabolized to become formic acid, which is a more poisonous chemical substance. Methanol is found in denatured alcohol. Isopropanol, so this is rubbing alcohol. Ingestion can produce severe acute symptoms similar to ethanol intoxication, and it can persist for a long period of time because it is metabolized to become acetone, which has a longer half-life in the body. Then the fourth one is ethylene glycol, and this can be found in antifreeze. Ingestion can produce severe metabolic acidosis and renal tubular damage. To analyze alcohol in the laboratory, we can do a chemical method, enzymatic method. Number one, ethanol in the presence of nicotinamide adenine dinucleotide. In the presence of alcohol, dehydrogenase will be converted to acetaldehyde plus NADH, which can be measured using spectrophotometry. Number two, gas liquid chromatography, which is the reference method, can of course be used for the measurement of alcohol. It can differentiate between the various types of alcohol and quantify them. Another poisonous substance is carbon dioxide. It is toxic because it binds with hemoglobin. And whenever it's bound to hemoglobin, therefore hemoglobin cannot be free to transport oxygen. It can produce hypoxia, and the first organ to suffer from this is the brain, and then of course the heart. Whole blood is required for analysis, and the method of choice is gas liquid chromatography. Cyanide. So this is a super toxic substance. That means a very small amount is enough to cause fatality, with exposure occurring through the different routes like oral ingestion, inhalation, or transdermal absorption. This is used in insecticides and rodenticides. Cyanide can bind to heme and mitochondrial cytochrome oxidase. The method of choice is ion selective electrode. Metals, heavy metals. Number one, arsenic. So this binds to thiol groups in proteins, and ionized arsenic is excreted in urine. Specimens can therefore be blood or urine to determine short-term exposure. Aside from that, we can also utilize hairs and fingernails to assess long-term exposure. The method of choice for arsenic determination is atomic absorption spectrophotometry. Lead. So this again binds to proteins and inhibits many enzymes. It also inhibits the production of heme. Toxicity may happen when lead is ingested, inhaled, or contacted dermally. So there are many sources of lead, for example, paint products or toys, right? So also crayons. So those are the common sources of lead exposure. This substance interferes with the synthesis of heme at various stages, and this alteration results in the formation and accumulation of zinc protoporphyrin, or ZCPP, in which zinc replaces iron in the tetrapyrrole ring in hemoglobin. So, as I have mentioned, there are many products that can lead to exposure to lead. For example, products that are laden with paint chips, and especially in children. Laboratory results will indicate the following. Number one, in hematology, we will find the presence of basophilic stippling of red blood cells. In urinary excretion, analysis of urine may indicate an increase in aminolevulinic acid and coproporphyrins. The level that is acceptable is less than 10 micrograms per deciliter in young children. Okay, for analysis in the laboratory, whole blood specimen is required and can be measured using atomic absorption spectrophotometry or anodic stripping voltammetry. So the next heavy metal is mercury. This was once used as an important component of some medical products like the BP apparatus, the sphygmomanometer, and also the thermometer. Right, so also this is found in dental amalgam or the dental filling. Right, so we know it locally as pasta, the black component, heavy metal component. And also let me add that there is a naturally occurring form of mercury which we call methyl mercury that can cause poisoning of fish. So therefore, if a person is fond of eating fish, so that person may also experience mercury poisoning. And another one is in people who are working in the mines, because mercury is used in the extraction of gold. Right, so those are means by which mercury can can expose someone to poisoning. So the method of choice is atomic absorption spectrophotometry and anodic stripping voltammetry. So next we have pesticides. It includes the insecticides and herbicides, and they may contaminate our food or be inhaled. Can also be absorbed through our skin and ingested by hand-to-mouth contact. Organophosphate and carbamate insecticides can inhibit the enzyme acetylcholinesterase. If you remember, this is an important enzyme in the uh, muscular contraction. So analysis, enzyme activity is measured in the erythrocytes, particularly acetylcholinesterase or serum pseudocholinesterase. There are also therapeutic drugs or medicines that are commonly abused and can lead to poisoning. Number one is salicylate. An example of that is acetyl salicylic acid or aspirin. We know that this is used as an analgesic, antipyretic, and anti-inflammatory. And at the same time, it can also be used as a blood thinner. So most of the time, this is administered orally, and toxic effects may happen at high dosage, which can cause an mixed acid-base balance like metabolic acidosis and respiratory alkalosis because of stimulation of the respiratory center. And acidosis happens because of production of ketone bodies and excess formation of lactic acid. Analysis is done by the ferric nitrate method, in which the colored product can be measured spectrophotometry, using the spectrophotometry, or can also be using gas or liquid chromatography. Another substance that is abused is acetaminophen, also known as Tylenol, brand product. And here in the Philippines, we also know this as paracetamol. This is used as an analgesic and antipyretic. Metabolism, so we administer this orally, and elimination is dependent on the metabolism by the liver. Toxic effect at high dosage, especially if you exceed 6 tablets in a day, 500 milligram tablet, can lead to liver failure or liver toxicity. Analysis is by immunoassays and high-performance liquid chromatography. Okay, so illegal drugs, of course, in some countries, they may no longer be legal. Number one is amphetamine or methamphetamine. Locally, we know this as shabu. Right, so the function of this drug is to treat narcolepsy and in disorders that affect the ability to focus. They are stimulants, therefore they provide sense of mental and physical well-being. Analysis is done using immunoassays or gas liquid chromatography. Letter B, anabolic steroids. So this is in people who are always going to the gym, right? So they are used to increase the muscle mass and improve athletic performance. So this is banned, especially in international competitions. So the method of choice can be either gas chromatography or liquid chromatography. So the second one is, the third one rather, is cannabinoids. They are hallucinogens. That means they provide a feeling of mental well-being and euphoria, and impair mental function or can cause short-term memory. An example of this is marijuana, a plant and that the primary component of this marijuana is tetrahydrocannabinol. So this can be taken by smoking, and sometimes I heard that it was even incorporated in some food, right? So the half-life of tetrahydrocannabinol is 1 day after single use and 3 to 5 days following chronic use. So therefore, it will not be detected in the blood once that time period is over. The metabolism of THC is that it is distributed in lipophilic tissues like the brain and adipose tissue. Elimination is dependent on the liver, K2 alpha tetrahydrocannabinol 9-carboxylic acid with metabolitic product that is filtered by the kidney. So this substance, carboxylic acid, is the major urinary metabolite, and again detectable in the urine 3 to 5 days after single use, and it can last for as long as 4 weeks following chronic use. Analysis can be done using immunoassay, gas chromatography, and mass spectrometry. Cocaine, another natural product obtained from flowers from the coca plant. It is used as a local anesthetic, and at higher levels can act as a CNS stimulant. The half-life is only 0.5 to 1 hour, and elimination is again based on liver metabolism. The primary metabolite is called benzoyl-ecgonine and is filtered by the kidney. This substance, benzoyl-ecgonine, is detectable in urine for 3 days following single use and for as long as 20 days following chronic use. The methods of choice are immunoassays and gas chromatography mass spectrometry. Another substance that may be abused are the opiates. So this includes opium, morphine, and codeine. So chemically, they are known as heroin, or dilaudid, oxycodone, and it can also be called demerol, methadone, darvone, tauin, and fentanyl. So their function is to act as an analgesic. They are also sedatives and they have anesthetic properties. Metabolism, the respiratory center is depressed that can cause respiratory acidosis. The method of choice are immunoassays, GCMS. Phencyclidine or PCP. This is a stimulant and at the same time a depressant. It can have an anesthetic effect and also a hallucinogenic effect. It is distributed in lipophilic tissues like the brain and adipose tissue. Elimination again is dependent on the liver, and about 10 to 15% of this is filtered by the kidney. It can be detected in our urine for as long as 7 to 30 days following chronic use. Method of choice the same as the others, immunoassays and GCMS. Another group of substances that are used um, or abused are the tranquilizers. So they can cause um, sedation or even feeling of sleepiness, immediate sleepiness. So there are examples here. Letter A is barbiturates. We have mentioned this in therapeutic drug monitoring, the barbitals, the phenobarbital, amobarbital, secobarbital, and pentobarbital. Then the more important ones would be the benzodiazepines. Examples of these are diazepam, also known as Valium, chlordiazepoxide or Librium, and lorazepam. So Ativan, maybe you have heard of Ativan being used in date traps. So during a date, the other person may be given this tablet dissolved in the drinks that can cause that person to be sedated. So they are sedative hypnotics that can produce depression of the CNS. And again, respiratory center can lead to, are depressed and therefore cause respiratory acidosis. Right, so method of choice, immunoassays and GLC or gas liquid chromatography. Now let's have the second half of this presentation, the tumor markers. So as the name implies, they are substances. They are mainly proteins, glycoproteins that are found normally in serum, but it is elevated. They are elevated in certain forms of cancer. So therefore, its main use is to detect for cancer and also to monitor therapeutic response to treatment. So we have number one, carcinoembryonic antigen or CEA. This is used in the management of gastrointestinal tumors, particularly colon cancer, and adenocarcinomas of the colon, pancreas, liver, and lungs. So most of the time, this is important in colon cancer, CEA. But this is also found in other conditions like inflammatory bowel disease, ulcerative colitis, Crohn's disease, polyps, tumors of the GI tract, and among cigarette smokers. The highest levels of CEA are found in metastatic disease. So that means it has already spread from the origin. So we call that carcinoma in situ when it is only found in one site, but then after that it can metastasize, and invade other tissues or organs. Number two, should be number two, is alpha fetoprotein or AFP. This is normally found in embryonic tissues and fetal tissues. AFP levels is elevated in patients with hepatocellular carcinoma, liver cancer, hepatoblastoma, and testicular and ovarian cancer. So this can also be found elevated in cases of viral hepatitis, cirrhosis, and ulcerative colitis. This is an important marker for monitoring cancer therapy, right? So most of the time, what is connected to AFP is liver cancer, very specific. Then number four is human chorionic gonadotrophin. We mentioned of this as a marker of pregnancy. And it's a glycoprotein having two components, the alpha and the beta components or subunits. This is found in urine and serum during pregnancy. Increase in HCG levels may be found in cases of certain types of cancer like testicular cancer and various other tumors. So levels are useful in evaluating cancer with gestational trophoblastic disease, testicular tumors, and ovarian germ cell tumors. Number five, should be four, prostate-specific antigen. This is another glycoprotein that is found in seminal fluid formed after ejaculation. Normal prostate tissue contains PSA, but only in small amount, very small amount. It is increased in prostate cancer, BPH or benign prostatic hypertrophy, and acute or chronic prostatitis. Levels correlate with prostate size. So as you know, the most common form of cancer in men is prostate cancer, especially those who are already older than 35 years old. Okay, one way to screen for this cancer is by prostatic massage, okay, or so digital rectal examination. Stage of prostate cancer is also important, okay, and a response to treatment. So those are the applications of measurements of PSA. So basically, this is used to screen for prostate cancer in conjunction with DRE or digital rectal examination. CA125, also known as mucin 16 or MUC16. So this is used as a tumor marker because the concentration is elevated in patients with ovarian cancer. So it's also elevated in some benign conditions. And this is found in 50% of women with early stage of ovarian cancer and 80% of women with advanced ovarian cancer. Monitoring this substance is useful for the determining the response to cancer therapy. Also for prognosis after. Another tumor marker is called CA19-9 that is also called as cancer antigen 19-9 or sialylated Lewis antigen. Although this is a good marker for pancreatic cancer, because of many false negatives and false positives, the American Society for Clinical Oncology discouraged use in the and diagnosis. Right, but people, of course, with pancreatic masses, this CA19-9 can be very useful in distinguishing cancer and other pathologies of the pancreas. The last on the list is beta-2 microglobulin, which is a component of the MHC class 1 molecule. And if it is class 1, therefore it's found in all nucleated cells, excluding the red blood cells. In humans, the B2 or the beta-2 microglobulin is encoded by the B2M gene, and it is used for the diagnosis of myeloma, multiple myeloma. So that is the last slide. However, I'm not saying that these are this is not really a complete list of tumor markers. You may find that there are other molecules that can be utilized to diagnose or help in the diagnosis of tumor markers. So I advise that you read other references for a more complete list of tumor markers. Thank you.